Welcome to episode 9 of Pesos and Paws, the Pet Health Podcast. Again, I'm your host, Alex, and here to say that if your cat is peeing outside the box, it's not naughty, it's information. And we are here to decode that message with Dr. Aijan from the Cat Clinic. Welcome back, Doctor.
Thank you. I'm happy to be back here. Okay. Right. So, quick tip, you have to check yung urination ng ating mga pets. Ano? Okay. Sige, let's get started.
And just a quick reminder, this podcast is for educational purposes and not a substitute for a hands-on veterinary exam. If you're worried about your cat, there's nothing like a visit to that nearest vet clinic. Tama ba, Doc?
Tama. We always recommend that.
Okay. All right. So let's dive in
Sure.
to our first question. So, from a vet's lens, Doc, what medical causes are the most common na na-encounter niyo?
So, specifically for the urinary issues, very common kasi in cats yung mga lower urinary tract diseases. That's an umbrella term that we use. It describes stuff like diseases with regards to the bladder, such as UTI. So, the I in UTI is infection, bacteria usually na nasa wiwi at nasa buong tract na yon. But outside of that, there's also stuff like crystals. And crystals, kapag super severe nito, the urine becomes so concentrated, or in response to some agent na nagdidikit dun sa mga crystals na yun, they can form stones. So those are things na frequently natin na-encounter in our cats. Next, actually, cats are kind of unique. They can also develop urinary issues in response to stress. So, natakot or for whatever stressful stimulus na usually nasa bahay, yan, nagkakaroon sila ng mukhang UTI na problems. Typically, we call that FIC, feline idiopathic cystitis. Short of those lower urinary tract problems, sometimes kidney issues can also present na masyadong marami, masyadong madalas na umihi, and then that may lead to inappropriate urination. And yung mga uncommon or lesser common natin mga problems, they can present with sphincter issues. Sometimes that's genetic, sometimes that's later onset. They might also have some, let's say, blood sa wiwi, and that might already be a symptom of something like a cancer of the bladder. They can also get that. Ganon. And then other times kasi it might not even be urinary in nature. Pwedeng constipated lang yung pusa, napapawiwi na, hindi niya malabas yung kanyang pupu. So those are some of the things. Hindi exhaustive yung list natin, pero some of the things na could be when it comes to a urinary problem in our cats.
Okay, so what are the red flags naman that owners, us pet owners, must watch out, with regards to kidney diseases or yung UTI.
Yeah, so kidney and urinary. So if you have a male cat, you have to really make sure na kaya niyang umihi regularly. Kasi the difference in the anatomy, dun sa bladder ng pusa, sa female cats, isang diretsong tube lang yan eh. It comes out. Sa male cats, from the bladder, it goes into a tube. Pagdating sa area or yung penis ng cat, mas nagtitaper pa siya almost into a cone. So yung narrowing na yun, it makes it so na any little inflammation, pamamaga basically, or any little object na secreted in that area, let's say that's a stone or that's even if mucus, nagpeplema, parang ganon, yung urinary tract nila, that can facilitate na mas madaling mabara or mas madaling obstructions sa outflow ng urine. And when it comes to male cats, that's actually kind of often. Another risk factor is when you notice stuff like blood sa wiwi, and then more milder, you might notice them earlier na frequent yung litter box trips nila. Typically, 2 to 3 times a day lang siya umihi. Bigla ngayon, parang every 10 minutes umiihi na. So that's one early red flag that you might be able to notice. Another thing is, they might be grooming themselves more frequently. That may indicate discomfort or pain dun sa kanilang genital areas, genital urinary areas.
So if not medical, ito naman actually are for behavioral and environmental. Now, if not medical, what behavioral or environmental factors drive it?
Okay, so when you're noticing urinary issues, and then that may also include yung inappropriate, nasa malapit sa litter box pero wala doon. So first things you have to check, is the litter box clean?
Okay.
Right? Kasi gusto naman natin tayo na sumi-CR sa malinis na CR, ganun din yung mga cats natin.
Lagi tayong nililinis yan as,
Yes,
as
oo.
cat parents. Kasi
Kailangan.
alam natin yan that they don't pee there if it's dirty. Yun
Yeah.
talaga.
They know. Gusto nila na when they get into the sand, malinis. Right? Mapawiwi man yan or pupu, linisin muna natin. So regular cleaning of the litter box is a very important factor. When it comes to other non-medical causes, we're looking at social issues. So let's say if you have a household that has multiple cats, there might be friction between cats. So you might say, okay, they get along, they eat together. Well, they don't have a choice, they live together. Eh. Ano. Pero you might want to reevaluate if all your cats are really close. Kasi if your cats they're all adults and they've not had time to bond as young kittens, they might be of different social orders. Ano? Kasi unlike sa dogs, you have dogs in a home, isang pack yan, grupo yan. Cats, you can have different groups of cats in the same home and they're all different na, hindi sila friends. Ganon. So social pressures that might show up as, this cat might want to use the litter box, pero andun yung isang kapwa niya na taga dito din pero hindi sila super okay. I don't wanna see that cat. Sige, magpipigil ako ng ihi. That might be one issue as a social parang in between, like inter-cat kind of interaction. Other times, yung mismong, let's say, it's a solo cat household pero ganun din, nagkakaroon tayo ng inappropriate urination. Might be the location ng litter. Ayaw natin na tagong-tago or like in the corner in a dark space yung area. What the cat wants is to feel safe and can escape anytime. So that can also include some litter boxes kasi covered sila. Tapos may parang flappy door lang. Some cats, they tolerate that. Other cats, ayaw nila kasi parang they're trapping themselves willingly when at their most vulnerable. When they're using doing number one and number two. Some cats tolerate scented litters, like yung baby powder, ganyan. Other cats, ayaw. So, those stimuli may be triggers na, okay, hindi ko to masa-CR. Hindi ko gagamitin to. Ganon. And then, other times, it might just be some external factor not related to yung physical location ng litter box. It might be something like stress. So, kapitbahay or within the home, may renovation. You're having strangers sa bahay that can also be stress. They're already urinating. There might be some of those na parang, not to say attention seeking, but it might be sort of reactive kind of urination behavior na things you might want to watch out for if you're noticing na may magiging change dito sa daily schedule ng pusa nyo. Ganon. So that includes stuff like birthday party, visitors sa bahay. Usually early, halimbawa, January, after ng Christmas and New Year, meron akong mga pusa na merong stress-related na urinary issues.
You already tackled the typical stressors, no? The same thing that you tackled earlier, typical stressors that we see on the yung reason why our cats are experiencing UTI, no, or difficult in peeing. So, yun. So, let's move on to home adjustments. What home changes solve most cases?
So yeah. So the most common thing I see is there's too many cats for any one litter box, right? Ideally, for any resource, that includes yung food and water bowl, tigi-isa, yung mga pusa, that's the best thing. In a practical setting, let's say if you have 3 or more or 5 cats or more even, it's not easy or practical to have as many litter boxes as you have cats. Pero as much as you can, do that. And then it's good to space out yung mga litter boxes na yon. If it's one room and then it's the next room, a litter box, that's better. It's good to have those litter boxes not in line of sight, so hindi sila nagkikita.
Okay.
And another thing then, if magkatabi yung litter box, the cat will just see it as one big one. So dalawang magkatabing litter box, let's say, has been used. May wee-wee or poo-poo na doon.
Associated with the other one.
Yeah, may nakitang, may madumi na eh, hindi ko nagagamitin to. So that's the thing about cats din. Making sure na yung social order ng mga cats natin, if we have 2 cats that really don't get along, then we have to step in na hindi talaga tong pwedeng pagsamahin. Otherwise, they're going to stress each other out. They might even fight each other. And another thing to build on to that point, kasi before we notice na nag-aaway yung mga pusa, may mga certain thresholds pa silang natatawid. And they're usually non-verbal. A lot of the times, isang tingin lang, na kagad yun, nag-away na pala sila. A flick of the ear, a flick of the tail, and then it becomes verbal. There's a hiss, and then there's that kind of thing. And usually yun na yung napapansin ng owners. So a lot of the inter-cat interactions is something na magandang ma-make sure na, okay, hindi talaga sila nag-aaway. They sleep together, they play together, wala silang problems. And for solo cats, making sure na meron silang hideaway spots, quiet spaces, and then adequate facilities to use their own litter boxes. Ganon. And then, yeah.
Yeah. Actually, natakal mo na din any gradual change. If you have any gradual change
Gradual.
tips.
So, halimbawa,
Avoid
changing litter.
setbacks. Yeah. For sure.
Para sa akin kasi there's no one good litter. It just depends on yung need ng cat. Kasi some cats, they might find this one a bit too dusty. Yung material is more for our benefit. It's easier to clean, ganon. Pero whichever works for your cat, they don't have reactions or like local allergies, that's fine. Then that's good. And then for any like home or environmental issues natin, interesting story, meron akong patient na nagkaroon ng urinary issue kasi nag-rearrange sila ng furniture. So, medyo unique siya. Kasi what happened was, di ba? Yung cabinet, inaakit ng pusa.
Okay.
So, takot sila na baka malaglag yung cat. So, they had to move the cabinet to a place na hindi na kayang akitin ng pusa. Then, a couple weeks later, hindi na normal yung pusa. It was peeing blood. And then, yun lang yung ma-identify na possible change sa environment. It wasn't a UTI. Yan. So, gradual changes is a very, very important thing. And hindi natin bibiglain yung lifestyle ng pusa. Kasi usually, pag nag-settle into a rhythm sila, biglang parang nabaliktad yung mundo nila when we institute a change. Halimbawa, family member, let's say sa family natin may umalis, may magka-college, they might miss that person. That's really sa nang biglaan. Medyo mahirap siyang i-institute to do a gradual change. Conversely, may family na makikitira. Stranger in the home, that's another thing then.
There, din pala.
Yeah. And then, what else na stressors? I can't remember a lot. Pero there's a few, and then your vet can answer those when you have your consultations then.
Yes, tama. Okay, so let's move on to box type and placement. How important are the type, number, placement of litter boxes? Although kanina na mention na natin earlier, how important is it?
So the type does not really matter. I would say it only matters if you have, let's say, a really old cat. Meron ng bone issues, joint issues na you're going to have trouble na umakyat sa litter box. So you might want to keep it lower. But for the most part, bigger is better. And then as deep as something like 4 or 5 inches. So talagang meron silang space to bury yung kanilang wiwi and pupu, para wala tayong amoy sa bahay din. And then they get to exercise yung natural na behaviors nila. I don't recommend yung mga covered na mga litter boxes. So some cats might not use those kasi pag pumasok sila, okay, they're trapped na. Ganon. And then placement, a general area, hindi sa sulok, hindi sa kanto. And then if it's near, let's say, an exit point, so halimbawa near the hallway, or may place sila to run to, hindi lang siya isang one-way, that's good. And then nothing too dark, but nothing too busy din. No? So hindi siya yung dadaanan ng everyone, hindi siya yung makikita ng everyone. So may konting intricacies siya. Pero once you employ it from the perspective ng pusa, you would understand, okay, this is a quiet place na pwede sila makawiwi. Pero if anything happens, then sa, may mga cats na medyo reactive, makaka-escape sila.
So what's the quick rule of thumb owners can remember?
So always check yung pag-urinate ng ating cat. So how many times in a day, that's the frequency, and yung urine volume or kung gaano karami yung wee-wee. No? Sometimes if the color is off, you might notice it's brown, you might notice it's red for blood. Other times then yung kanilang physical na presentation, especially for the male cats, I mentioned earlier, very prone sila to obstruction. So obstruction means yung mismong flow ng wiwi hindi kayang lumabas. They want to urinate, gusto nilang umihi, hindi makalabas. In most cases, that can be fatal in 24 hours. Just from hindi lang sila makawiwi. So that's a thing you have to monitor talaga na gusto nating nakakalabas, nakaka-flow yung ihi nila, especially for the males. And then if you ever notice they're vomiting, they're licking their genitals more often, they're urinating so often, off yung color, and sometimes they might urinate longer. pwedeng, usually iihi yan. That's like 5-10 seconds, tapos na, or 15. Then there are times na you might notice, oh, 1 minute nakapostura pa rin siya. Yeah, that could already be a sign na it's taking a while. Sometimes they don't even want to urinate. It's just painful. So parang gusto nilang umihi. Ano? And then they might cry out in pain as they urinate. So things like that to watch out for.
Yeah.
And yeah.
You should really pay attention to what our cat is like
Yeah.
feeling, what they're doing.
Tama.
Unusual, no?
It's good to be involved sa cats natin.
And when do we seek vet help?
Okay. So first things first is if your cat is displaying abnormal issues, you can contact your vet right away. And then they might help to guide you how serious it is. Is it an emergency na in the dead of night you have to get emergency help, or can it wait in the morning? But for the most part, as long as urine is flowing, it's just discomfort, they're still eating and drinking, you might be able to wait the next day. But let's say in a case of the worst case scenario where that's a male cat and obstructed yung urine flow niya, namamatay na tong pusang to, rush it kagad kasi that's a dying cat already. As they start, una magta-try pa yun umihi, walang lumalabas. Eventually, nagbi-build up yung toxins sa dugo, and then one of those is potassium na ipon sa dugo that stops muscle contraction kasi. And then they can just become stiff. So mukha silang vegetable. Kapag super advanced na or matagal na yung obstruction ng urine nila, they just look like vegetables. Ganon. And then removal ng obstruction, mapapa-flow yung wee-wee, nakaka-recover kagad sila. Ganon. So typically any kind of illness na presenting dun sa outside of sa normal behaviors ng cats natin is something na warranting a vet consultation.
Okay, so now let's move on to budget and safety net.
Yes.
No? What cost what cost yung usually na will take us if ever we encounter this? We go to the vet and then we have to pay for it. Do you have any ranges?
Yeah. So for yung most common kinds of urinary problems, yung consultation and diagnostics, they can go anywhere from, as little as 1,000, simple microscope urinalysis lang, upwards of like maybe even 5 or 8,000, depending on what we'd like to check dun sa pusang yan. Is that a symptom of urinary stones? Maybe kailangan pa ng X-ray or ultrasound imaging. And then there might be other times where secondary tests are needed. So that number is general, usually for just the diagnosis, including treatment. And let's say that this cat was confined. Hindi siya makawiwi. You might be looking at 10, 15,000 for a typical na
Separate pa from the diagnosis.
from the diagnostics. So that's just the hospitalization and treatment.
And then sa medication.
Sa medication, about like siguro 2 up to 3,000 pesos if ever. And then usually that also involves a diet change. So the diet is also not included in that. And then there are times na yung cat, okay, let's do this diet for 1, 2, 3 months, okay na tayo. Other cats, may mga diet na maintenance na. Prone siya magganitong stones or crystals. Itong diet na lang yung pwede niyang kainin. Otherwise, magkakaroon talaga siya ng ganitong problem. And then that's a long-term issue na habang buhay yung pusa mo, that's a thing you have to consider for the cost of. Then, yan.
And yeah, for sudden illnesses and accidents, standard insurance pet health may help. Eligible claims and terms may apply. Key reminder, outside the box peeing is a message. Check medical first, then environment. Thank you so much, Doctor, for joining
Thank
us
you as
today. Such a pleasure having you here in Pesos and Paws.
Thank you so much. I'm so happy to be here.
And if you want to learn more about Standard Insurance Pet Health Insurance, just check out our website at www.standard-insurance.com and check our Facebook page at Standard Insurance Pet Health. See you next time on Pesos and Paws. Stay informed and keep those tails wagging. Bye!